Deep vein thrombosis, or DVT, is a serious medical condition where a blood clot forms in a deep vein, most commonly in the leg. Recognizing the signs and symptoms early can be life-saving, as untreated DVT can lead to dangerous complications like pulmonary embolism. In this video, we'll guide you through what DVT is, how to spot it, and what steps to take if you suspect you have one. Let's start by understanding why DVT happens and who is most at risk. DVT occurs when blood flow in a deep vein slows down or becomes blocked, leading to clot formation. This can happen due to prolonged immobility, such as sitting during long flights or bed rest after surgery. Other risk factors include certain medical conditions, pregnancy, smoking, and genetic predisposition. Understanding these causes helps you be more aware of your own risk and take preventive measures when necessary. Certain groups of people are more likely to develop DVT. These include individuals over the age of 60, those with a family history of blood clots, people who are overweight, and those who have recently undergone surgery or experienced trauma. Women who are pregnant or taking birth control pills also face a higher risk. Knowing your risk factors can help you stay vigilant and seek help early if symptoms arise. Recognizing the symptoms of DVT is crucial for early intervention. The most common signs include swelling in one leg, pain or tenderness that often starts in the calf, and a feeling of warmth over the affected area. Sometimes, the skin may appear red or discolored. These symptoms can develop slowly or suddenly, so it's important to pay attention to any unusual changes in your legs. One of the hallmark signs of DVT is swelling, usually in one leg. The swelling may be noticeable and can make your leg feel heavy or tight. It's important to compare both legs. If one is significantly larger or feels different, this could be a warning sign. Swelling can occur gradually or appear suddenly, so don't ignore any changes, especially if you have risk factors for DVT. Pain or tenderness in the leg, especially in the calf, is another common symptom of DVT. The pain may feel like a cramp or soreness, and often worsens when standing or walking. It's not always severe, but persistent discomfort that doesn't go away should be taken seriously. If you notice pain along with other symptoms like swelling or redness, it's time to seek medical advice. DVT can cause noticeable changes in the skin over the affected area. You might see redness or a bluish tint, and the skin may feel warm to the touch. These changes happen because the clot blocks normal blood flow, leading to inflammation. If you observe any unusual skin discoloration or warmth, especially with swelling or pain, it's important to get checked by a healthcare professional. While swelling, pain, and skin changes are the most common symptoms, some people may experience less obvious signs. These can include a mild fever, unexplained fatigue, or visible veins near the surface of the skin. Sometimes, DVT can be completely silent, with no noticeable symptoms at all. That's why it's important to be aware of your risk and seek medical advice if you have any concerns. If you notice any of the symptoms we've discussed, especially if you have risk factors for DVT, it's crucial to seek medical attention promptly. Early diagnosis and treatment can prevent serious complications. Don't wait for symptoms to worsen. If you experience sudden shortness of breath, chest pain, or coughing up blood, seek emergency care immediately, as these could indicate a life-threatening pulmonary embolism. Diagnosing DVT typically involves a combination of a physical exam, medical history, and imaging tests. Your doctor may check for swelling, tenderness, and skin changes, then order an ultrasound to visualize the clot. Blood tests, such as the dimer test, can also help rule out or confirm DVT. Accurate diagnosis is essential for starting the right treatment and preventing complications. Ultrasound is the most common and reliable test for detecting DVT. It uses sound waves to create images of the blood vessels in your leg, allowing doctors to see if a clot is present. The procedure is painless and non-invasive, making it a preferred choice for both patients and healthcare providers. If DVT is suspected, an ultrasound is usually performed right away. The dimer test measures a substance released when a blood clot breaks down. High levels of dimer in your blood can indicate the presence of an abnormal clot, such as DVT. However, other conditions can also raise dimer levels, so this test is usually combined with imaging for a definitive diagnosis. It's a useful tool for ruling out DVT in low-risk patients. In some cases, doctors may use additional tests to confirm DVT, such as venography or MRI. Venography involves injecting a contrast dye into the vein and taking X-rays to visualize the clot. MRI can provide detailed images, especially for clots in the pelvis or upper leg. These methods are less common but can be helpful in complex cases. If left untreated, DVT can lead to serious complications. The most dangerous is a pulmonary embolism, where part of the clot breaks off and travels to the lungs. This can cause sudden chest pain, difficulty breathing, and even death. DVT can also cause long-term problems like chronic leg pain and swelling, known as post-thrombotic syndrome. Early treatment is key to preventing these outcomes. A pulmonary embolism is a medical emergency. Signs include sudden shortness of breath, sharp chest pain, rapid heartbeat, and coughing up blood. If you or someone you know experiences these symptoms, call emergency services immediately. Quick action can save lives, as pulmonary embolism can be fatal if not treated right away. Post-thrombotic syndrome is a long-term complication of DVT. It occurs when the clot damages the veins, leading to chronic pain, swelling, and sometimes skin ulcers. Symptoms can develop months or even years after the initial clot. Managing post-thrombotic syndrome involves compression stockings, exercise, and sometimes medication to improve blood flow and reduce discomfort. If you suspect you have DVT, avoid massaging the leg or walking excessively, as this could dislodge the clot. Instead, keep your leg elevated and seek medical attention as soon as possible. Do not attempt to treat DVT at home. Only a healthcare professional can provide the right diagnosis and treatment to prevent complications. Treatment for DVT focuses on preventing the clot from growing, breaking loose, or causing further complications. The mainstay of therapy is anticoagulant medication, also known as blood thinners. In some cases, additional interventions like clot-busting drugs or surgical procedures may be necessary. Your doctor will tailor the treatment plan to your specific situation. Anticoagulants, or blood thinners, are the first line of treatment for DVT. These medications help prevent new clots from forming and stop existing clots from getting bigger. Common options include heparin, warfarin, and newer oral anticoagulants. Your doctor will monitor your blood closely to ensure the medication is working safely and effectively. In severe cases, doctors may use clot-busting drugs called thrombolytics. These medications dissolve clots quickly but carry a higher risk of bleeding, so they're reserved for life-threatening situations or when other treatments haven't worked. Thrombolytics are usually given in a hospital setting under close supervision. Sometimes, surgery may be needed to remove a clot or place a filter in the large vein vena cava to prevent clots from reaching the lungs. These procedures are typically reserved for patients who can't take blood thinners or have recurrent clots despite treatment. Your healthcare team will discuss the risks and benefits with you if surgery is considered. Compression stockings are often recommended for people with DVT to reduce swelling and prevent post-thrombotic syndrome. These special socks apply gentle pressure to your legs, helping blood flow back to the heart. Wearing them regularly can improve comfort and lower the risk of long-term complications. Making healthy lifestyle changes can help prevent DVT and support recovery. Staying active, maintaining a healthy weight, quitting smoking, and managing chronic conditions like diabetes or high blood pressure all contribute to better vascular health. Your doctor may also recommend regular checkups to monitor your progress. Long periods of sitting, such as during flights or car rides, can increase your risk of DVT. To prevent clots, take regular breaks to stand up and stretch, flex your ankles, and stay hydrated. Wearing loose clothing and compression stockings can also help. If you have a history of DVT, talk to your doctor before traveling. Regular physical activity is one of the best ways to prevent DVT. Walking, swimming, and cycling all promote healthy blood flow in your legs. Even simple exercises like ankle circles or leg lifts can make a difference, especially if you have a sedentary job. Aim for at least 30 minutes of moderate exercise most days of the week. Staying well hydrated and eating a balanced diet can help reduce your risk of DVT. Dehydration can make your blood thicker and more likely to clot. Focus on drinking plenty of water and eating foods rich in fiber, vitamins, and minerals. Limit salt and processed foods, which can contribute to swelling and poor circulation. If you have chronic health conditions like diabetes, high blood pressure, or heart disease, managing them effectively can lower your risk of DVT. Work with your healthcare provider to keep these conditions under control through medication, lifestyle changes, and regular monitoring. Good overall health supports healthy blood flow and reduces clot risk. Pregnancy increases the risk of DVT due to hormonal changes and increased pressure on the veins in the pelvis and legs. Pregnant women should be aware of the symptoms and take preventive steps, such as staying active, wearing compression stockings, and following their doctor's advice. Early detection and treatment are especially important during pregnancy. Certain types of birth control, especially those containing estrogen, can increase the risk of DVT. If you have other risk factors, talk to your doctor about safer alternatives. Being informed about your options helps you make the best decisions for your health and reduces the chance of developing a blood clot. Some people inherit genetic conditions that make them more prone to blood clots, such as factor V Leiden or prothrombin gene mutation. If you have a family history of DVT or unexplained clots, your doctor may recommend genetic testing or preventive measures. Knowing your genetic risk can help you take proactive steps to protect your health. Hospitalized patients, especially those recovering from surgery or illness, are at higher risk for DVT due to immobility. Hospitals often use preventive measures like blood thinners, compression devices, and encouraging early movement. If you or a loved one is hospitalized, ask about DVT prevention strategies to stay safe during recovery. Older adults are more susceptible to DVT due to age-related changes in blood vessels and increased likelihood of chronic conditions. Family members and caregivers should watch for symptoms like leg swelling, pain, or skin changes. Early detection and prompt treatment are especially important in this age group to prevent complications. While athletes are generally healthy, they can still develop DVT, especially after injuries or long periods of inactivity, such as during recovery from surgery. Symptoms may be mistaken for muscle strains, so it's important for athletes and trainers to recognize the warning signs and seek medical evaluation if symptoms persist. People with cancer have a higher risk of developing DVT due to changes in blood clotting and the effects of certain treatments. Cancer patients should be vigilant for symptoms and discuss preventive strategies with their healthcare team. Early detection and management are key to reducing complications in this group. Obesity is a significant risk factor for DVT, as excess weight puts additional pressure on the veins in your legs. Losing weight through healthy eating and regular exercise can lower your risk and improve overall vascular health. If you're overweight, talk to your doctor about a safe weight loss plan. Smoking damages blood vessels and increases the risk of clot formation. Quitting smoking is one of the most effective ways to reduce your risk of DVT and improve your overall health. If you need help quitting, reach out to your healthcare provider for support and resources. Dehydration can make your blood thicker and more likely to clot. It's important to drink enough fluids, especially during hot weather or when you're physically active. Carry a water bottle with you and make hydration a daily habit to help prevent DVT. Certain medications, such as hormone therapy, chemotherapy, or steroids, can increase your risk of DVT. Always inform your doctor about all the medicines you're taking and ask if any of them could affect your clotting risk. Your healthcare provider can help you weigh the benefits and risks of each medication. Surgery, especially orthopedic procedures like hip or knee replacement, increases the risk of DVT. Hospitals use preventive measures such as blood thinners, compression devices, and encouraging early movement to reduce this risk. If you're scheduled for surgery, discuss DVT prevention with your surgical team. Long-term immobility, such as being bedridden or using a wheelchair, can slow blood flow and increase the risk of DVT. Regular movement, physical therapy, and preventive medications can help reduce this risk. Caregivers should encourage and assist with mobility whenever possible. Air travel, especially on long flights, can increase the risk of DVT due to prolonged sitting and dehydration. To lower your risk, stand up and walk around every hour. Do simple leg exercises in your seat, and drink plenty of water. Compression stockings may also be helpful for high-risk travelers. People with desk jobs or sedentary lifestyles are at increased risk for DVT. Make it a habit to stand up, stretch, and walk around every hour. Simple exercises like ankle pumps or calf raises at your desk can also help keep your blood flowing and reduce clot risk. Varicose veins can increase the risk of DVT by slowing blood flow in the legs. If you have varicose veins, talk to your doctor about ways to manage them and reduce your risk. Compression stockings, regular exercise, and maintaining a healthy weight can all help improve circulation. To recap, DVT is a serious condition that requires prompt recognition and treatment. Watch for symptoms like swelling, pain, and skin changes in one leg. Know your risk factors and take preventive steps, especially during travel, after surgery, or if you have chronic health conditions. Early intervention can prevent life-threatening complications and support a healthy recovery. If you suspect DVT or have concerns about your risk, don't hesitate to contact your healthcare provider. Stay informed, take preventive measures, and encourage loved ones to do the same. For more information, consult reputable medical sources or speak with a doctor. Your health and well-being are worth protecting. Stay proactive and vigilant.